Welcome to the Tobacco Online Policy Seminar Talks. Thank you all for joining us today. I'm Chen-Nan Wang, a postdoctoral research fellow at the University of Michigan. TOPS is organized by Mike Pesco at the University of Missouri, Che Shang at the Ohio State University, Michael Darden at Johns Hopkins University, Jamie Hartman Boyens at the University of Massachusetts Amherst, and Justin White at Boston University. The seminar will be 1 hour with questions from the moderator and discussants. The audience may post their questions and comments in the Q&A panel, and the moderator will draw from these questions and comments in conversation with the presenter. Please review the guideline from tobaccopolicy.org for acceptable questions. Please keep the questions professional and related to the research being discussed. Questions that meet the criteria for the seminar series guidelines will be shared with the presenter afterwards, even if they are not read aloud. The questions are well and very much appreciated. The presentation is being video recorded and will be made available along with the presentation slides on the tobacco website, tobaccopolicy.org. Now I will turn the presentation over to today's moderator, Jamie Hartman Boyens from the University of Massachusetts Amherst, to introduce our speaker.
Thank you so much. So today we continue our summer 2025 season with a single paper presentation by Justin White entitled Effect of a Minimum Floor Price Law for Tobacco Products on Tobacco Sales in Oakland, California. This presentation was selected via a competitive review process by submission through the TOPS website. Justin White is an associate professor in the Department of Health Law, Policy, and Management at Boston University School of Public Health. He's a health economist who evaluates the effects of interventions and policies on behavioral risk factors for chronic disease, including tobacco use. He has conducted randomized trials of behavioral interventions for smoking cessation, such as monetary incentives and peer support, and studied a variety of tobacco policies, including excise taxes and sales restrictions. He's also a founding member of TOPS. Dr. White, thank you for presenting for us today.
Well, thank you. It's always a pleasure to be part of the TOPS community, and I'm appreciative that I was invited to give this talk. Hopefully you can see my slides. Today I'm going to be presenting a paper that evaluates a local policy in Oakland, California, in which the city set a minimum floor price on cigarettes and cigars. And this paper is joint work with Serge Atherwood and Dori Apollonio, both at UCSF. So this study was funded by a grant from the California Tobacco-Related Disease Research Program, which is supported by California's tobacco excise tax. Neither I nor my co-authors have competing interests to disclose, and we have never received funding from the tobacco or nicotine industries. And this study uses sales data from Nielsen. Nielsen is not responsible for and was not involved in preparing the results that we're going to report. So this presentation is based on a paper that we recently published in Tobacco Control. You can access the paper by following this DOI, bit.ly link, or QR code. I'm sure it's also been put in the chat. Let's dive in. So while excise taxes have been the primary approach to regulating prices of tobacco products, local jurisdictions are preempted from passing tobacco taxes in many states, including in California. And so what this means is that localities can't go beyond whatever tax rates are set by their state and the federal government. So minimum floor price laws, or I'll refer to them as MFPLs, they set a minimum price below which a product cannot be sold. And so some local policymakers and advocates see MFPLs as a complementary approach to excise taxes, and that's especially the case when a state preemption law might be in place. So New York City was the first in the nation to pass an MFPL. on tobacco products, and it set a floor price at $10 per cigarette pack back in 2013. Subsequently raised to $13 per pack. And it also incidentally sets floor prices for e-cigarettes and other tobacco products as well. So now there's at least 35 local jurisdictions in California that have an MFPL for one or multiple types of tobacco products. And several other jurisdictions are considering one. And I think this is in large part because the Public Health Law Center and American Lung Association have recommended an MFPL as one component of their model ordinance for tobacco retailer licensing, which many counties and localities have adopted, at least in California. So most of these jurisdictions with an MFPL in California are quite small, places that you probably never heard of, like Union City and Calistoga. Oakland became the most populous city to adopt an MFPL in California when it implemented it in 2020. So I want to quickly review just some theoretical aspects of an MFPL. Economists often use welfare analysis as a way of comparing the overall benefits and costs of a policy to society. They look at how it affects people's well-being, not just sort of prices and profits. And welfare effects are not really the focus of this talk. They're actually not even really discussed in the paper. But and I'm going to spare you, I guess, a bunch of supply and demand graphs. But I did want to briefly talk about sort of like what the anticipated welfare effects of MFPLs might be. So MFPLs are a form of price control, and these are generally considered to be inefficient under a basic economic model. And that's because under a basic economic model, consumers are assumed to be rational. And when MFPLs force prices above the natural market level, these rational consumers would have lower welfare because they're consuming less than they'd prefer. And so this efficiency cost is referred to by economists as deadweight loss. So however, a full accounting of the costs and benefits would need to consider that tobacco use leads to negative externalities such as secondhand smoke and negative internalities because consumers might make biased decisions due to addiction and other factors. And the increased costs of smoking due to externalities and reduced benefits of smoking due to internalities, they can be quite substantial for tobacco products. So once we factor those externalities and internalities into the equation, an unregulated market would lead to substantial deadweight loss, whereas an MFPL is going to actually reduce this inefficiency compared to sort of the unregulated market. And that's even if the floor price is not set optimally such that it would sort of perfectly offset these externalities and internalities. So an optimally set floor price, again, sort of like perfectly offsetting those externalities and internalities, that would eliminate any inefficiency and be sort of just as optimal as a tobacco excise tax that was optimally set would do. However, there's a key difference between taxes and MFPLs that a tax is going to raise revenue that can be used to cover things like healthcare costs or fund prevention programs. Whereas a floor price can reduce consumption to the right level, but the extra money is going to the tobacco companies through the higher prices that they charge rather than back to society. So what this means is that a well-designed tax is still going to be sort of the first best policy approach. However, again, going back to what I said in the last slide is that in many localities are preempted from establishing their own taxes, and so they can look towards these MFPLs as an alternate. And because the extra revenue from MFPLs goes to the industry, one might expect, all else equal, for them to get less political opposition or at least less industry opposition to being passed rather than sort of a similar sized tax might. Okay, so let's talk a little bit about the literature on MFPLs and what we know about them. And we're fortunate that my discussant today, as you'll hear in a moment, he's a co-author on many of these papers. So the recent wave of MFPLs, it follows an earlier generation of state minimum markup laws that set a minimum percentage markup on the wholesale or retail prices for cigarettes. And those state laws have been found to be largely ineffective. And that's because they typically had a small impact on the price of cheap products, again, because they're having setting a percentage markup. And they often still allowed cigarette price promotions. In contrast, many of the local MFPLs have been coupled with a ban on coupons and price discounts. So there's been a bunch of simulation-based studies that have looked at these newer MFPLs, and they tend to find that MFPLs can decrease smoking rates and also might decrease smoking disparities, and that's because disadvantaged groups might be disproportionately likely to smoke low-price brands that would be affected by an MFPL. And I'll call attention to my simulation study because it focused on Oakland, California, same as what the paper I'll be talking about today. It focused on Oakland before it passed its MFPL. So from that study, we projected that the MFPL in Oakland would lead to a reduced smoking prevalence by about 0.3 percentage points and decreased smoking intensity among those who continue to smoke by about 2%. So there's only been 3 studies to my knowledge that have empirically tested the impact of tobacco MFPLs. 2 of those have focused on MFPLs for cigars only, and they find that those MFPLs were associated with increased prices of tobacco products and decreased sales. And then there's one recent study that found no effect of New York City's MFPL on various outcomes, including cigarette prices, cigarette consumption, or smoking status. So that's sort of the literature, the landscape. So we're trying to fill this relative evidence gap. And in this study, we're evaluating the effect of a tobacco MFPL on several outcomes. So first, retailer compliance, which we're going to measure by whether prices rose above the floor price. We're going to look at overall sales for products subject to the MFPL, as well as sales by price segment, which we're going to define as those products that were priced above versus below the MFPL based on the pre-MFPL prices. We're also going to look at cross-border shopping and substitution to nicotine products that were not subject to the MFPL. And I'll tell you more about those in a second. So getting to the specifics, Oakland's MFPL was implemented in May 2020. The ordinance set a minimum price of $8 per pack for cigarettes and $8 for a package of cigars, including little cigars and cigarillos. And the ordinance, importantly, also banned price promotions that could be used to circumvent the policy. And it set a package size requirement of 20 little cigars and cigarillos. So the floor price was supposed to be adjusted annually for inflation. It's my understanding that this hasn't happened, at least at the last I checked, maybe a year ago. And while the MFPL went into effect in May 2020, enforcement was delayed until August of that year, reportedly because of competing priorities for the public health department, because this was, as you might recall, during the COVID pandemic. So Oakland also made 2 other policy changes at the same time as its MFPL. First, it expanded an existing flavored tobacco sales restriction, and this expansion newly covered tobacco specialty shops. So prior to that, there was an exemption for those tobacco specialty shops. The second policy that went into effect at the same time as the MFPL is that it banned tobacco sales at retail pharmacies. And I'm going to come back to the potential effects of these co-occurring policies later in my talk. Okay, so getting to the data that we use, we're using Nielsen retail scanner data, which were provided by the Kilt Center at the University of Chicago. Nielsen follows a panel of large retail chains nationwide, and the data track sales by individual product or UPC, and that's for each store that's in their data set. Our sample is going to be restricted to stores in the state of California, which is going to include 3 types of stores: pharmacies, convenience stores, and food stores. And our study period is July 2018 through December 2021. So in other words, we are looking basically at the first 20 months after the MFPL policy went into effect in Oakland. And we chose July 2018 as the start date because that's when Oakland's flavored tobacco sales restriction first went into effect. So the data are geocoded to the 3-digit zip code or zip3 level. And so for analysis, we're going to aggregate the 30 million observations to the zip3 by month level. And that's going to give us an analytic sample size of about 26,000 observations. So if we look at some sample characteristics, just very briefly, our analytic sample had about 3,500 stores. This included 27 stores located in Oakland and 89 in the Oakland adjacent border zip 3, which is that zip 3 that started with 945. So Oakland zip 3, which basically circumscribes the entire city, is 946. The adjacent zip code that we're going to look at for cross-border shopping is 945. All the other zip 3s, which is the vast majority, they're going to be located in the rest of California, and they are the donor pool of potential control units. And we're going to construct a matched control group for Oakland, as well as a matched control group for that Oakland adjacent area from the donor pool of potential control stores. So the outcomes that we're focused on are tobacco prices and unit sales of cigarettes and cigars. Again, we're going to look overall as well as by price segment, where just to remind you, this is defined whether the pre-MFPL median price for that product, or UPC, was above or below the $8 cutoff for the floor price. We are not going to look at the above $8 segment for cigars just because those sales data were quite sparse in Oakland. We're also going to look at product substitutes in the form of e-cigarettes and vaping products, which I'll refer to here as ENDS products, as well as nicotine replacement therapy or NRT products, such as the nicotine patch or lozenges. And we're focused on NRT here because they serve as sort of an imperfect proxy for whether the MFPL might have led people to make more quit attempts as a result of the MFPL. So getting to our analytic approach, that's going to involve comparing tobacco prices and sales in Oakland versus the set of versus a matched group of zip 3s in non-bordering areas. And we are using synthetic difference in differences for estimation. What this does is it's going to algorithmically find the average of the zip 3s that basically best match the pre-MFPL outcome trend. This has basically like a weighted two-way fixed effects structure, if you're familiar with a two-way fixed effects model. And I'm quite fond of SDID. It tends to perform quite well, and I think is a really strong approach, especially when you have a single treated group like we have here. So SDID has a few strengths that are worth commenting on when you compare it to regular difference in differences or regular synthetic control analysis. So the first thing is that SDID only is going to require parallel trends for identification. What that means is that we only need the pretreatment outcomes in Oakland versus its sort of like matched comparator group to have the same trend, but not necessarily the same level. Like synthetic control, SDID is going to include a set of weights for each zip 3 to construct this matched control group. And this is going to make it easier to satisfy the parallel trends assumption that we're going to have to meet here. There's been some simulation evidence that shows that SDID tends to be less biased and more precise than difference in differences and synthetic control models. Okay, so if show here, whoops, I apologize. So here you can see the SDID equation, which estimates the average treatment effect on the treated, which is this tau parameter, this is the ATT. And so our model has fixed effects for each zip 3, which is going to account for area-specific factors that don't vary during the study period. We're going to have fixed effects for month, beta T. That's going to account for period-specific factors that are going to be common across all ZIP3s. The SDID procedure is also going to include these two sets of weights. I already sort of referred to one of them. The first one is these unit-specific weights, omega. They take the weighted average of those potential control units to find the best fit for the pre-policy treatment group. That's going to be very similar to the weights that we find in a regular synthetic control analysis. In our case, we're going to be constructing, again, a synthetic Oakland that's going to basically match the pre-period, pre-policy sales in Oakland itself. The second set of weights are the time-specific weights lambda, which are designed to balance the post and pre-treatment outcomes for control units, and that can improve the counterfactual trend that we're basically estimating the effect off of. And so then we're going to determine statistical significance using a permutation-based procedure, which is similar to what is used within synthetic control. We're also going to estimate event studies. And as a sensitivity check, we're going to implement regular synthetic control analysis, adjusting for a range of sociodemographic factors listed here. I'm not actually going to show you those results. They are in our supplement. I can describe them in the Q&A if you'd like, but basically they're very similar to our main results. Okay, so let me pause here for questions from our discussant in the audience. Thanks.
Thank you so much, Dr. White. Audience members, please do keep those questions coming in. But first, we'll hand over to our discussant for today. That's Dr. Kurt Ribisel, Professor and Chair of the Department of Health Behavior at the UNC Gillings School of Public Health. He studies the sales and marketing of tobacco products and is the PI of the UNC T-Course. Over to you, Dr. Ribisel.
Great. Thank you so much. I'm very excited about this particular policy solution and this really nice study that Dr. White and others have done. So just a couple things about a background on these minimum floor price laws. Part of what motivated me to be interested in studying this is that low-income people smoke at much higher rates than higher-income people, or less educated people than higher educated. And you see sometimes a gradient from the lower SES individual smoking in the 5, 6, 7% up to 20, 25, even up to 20, 25% for for the lower income individuals, and 5 to 7% for higher income individuals. And people with PhDs have, I believe, a 2 to 3% smoking rate, whereas some trade professions have 35% smoking rates. So there's this big disparity. We have not narrowed this disparity much over time, but I think the floor price has one of the greatest potentials for narrowing this gap between low income and high income smokers. Now, these laws originally came about because of sort of anti-competitive trade practices. They were not designed for health. They were designed to protect a mom and pop shop from a larger retailer that would come in, lower prices, ruin competition, and so forth. So when we first started studying them, we were kind of striking out. We found most states, or over half the states, have something on the books, and it's been there for a long time, but the prices weren't much different between the states with these floor prices and without. But they also weren't designed to reduce tobacco use or the public health effects. So that was a little bit frustrating early on because we thought they had such promise. And part of the reason for the promise is, in a way, lower income people smoke products that are cheaper. They tend, some, on average, I'm not saying every single person, but in general, they're smoking generic and cheaper brands. So if you can increase those prices, it will be more like a targeted approach to increasing price among lower-income people who suffer the most from cancer-related, tobacco-related deaths and have the greatest health effects. So in some ways, this is potential. Now, you want to earmark money to help low-income people quit as well, and not just try and increase prices on them. I would just mention, so they also were a useful tool in places that, like Justin mentioned, you can't raise taxes for certain reasons. And also politically, you can't raise taxes. So sometimes there's a policy, but politically, this is a policy that may have a little bit less objection and you can do it. Some people are against them, and Justin acknowledged this, because if you have a tax increase, the money can go toward the state tobacco control program or the local program or the general fund. But the retailer and the company can sort of keep the extra, can keep some of the extra money. And when people ask me, why would you do it if that's the case? And I think we have to think, what is our goal? And several people really think these are bad policies. And because, they believe that you should, they believe that you don't want to do anything that helps the industry. But my point is not, my goal is to reduce the death and disability from tobacco use and to reduce tobacco use and especially reduce disparities. And so that's why they're a second best approach. They're not the best. Excise taxes are better. That's the first line, and Justin made that very clear. But I think if you pair them with a higher excise tax that brings in the revenue, coupled with a floor price that thwarts the industry from shifting, sometimes they over and under shift. And Justin, you might want to talk a little bit about that if you've done work in that space. But you don't want the industry to constantly, if there's a dollar price hike, let the cheap products price go up maybe 5 or 10 cents. The more expensive products, where the higher income smokers, they may go up $1.20. So there's some shifting that they can address. So there's some reasons why I think combining them is smart. I'd love to hear your thoughts, Justin, on that kind of policy. Oakland had both.
Yeah, I appreciate all of that background, and highlighting some of the points that I did not have time to make around sort of like the history of these minimum pricing policies. So Oakland, they are not able to set their own tax, although there is an existing excise tax at the state level in California, which is fairly large relative to other states. And I do think that so I've done a little bit of work on the effect of the tax increase that happened most recently there, a $2 bump, which did substantially reduce smoking. And so I think that, like you're saying, that the combination of an MFPL with excise taxes can be quite effective, I think, and it is a great strategy. And, depending on sort of if you're a local policymaker who can affect prices through taxes, I think MFPLs, again, are a great approach.
Right. Dr. Hartman-Boyce, maybe you want to go to some of the questions in the webinar chat.
Thanks so much. Will do. So there's clearly a lot of interest in kind of the background and context and understanding these policies. So we have time for a few questions now. Were there any legal challenges to the MFPLs that you knew of?
So there was not one in Oakland. To my knowledge, there have not been major challenges in other places as well. Kurt probably knows this better than I do, but I have not heard of any.
I know the California Tobacco Program and others vet these, and they have this red light, green light, blue light, red light, green light thing. And if it's a really risky strategy, they don't encourage states and localities to do it. I know that I believe it's withstood some challenges. I see from the list, we have several people from AG's offices and several attorneys. I would love them to enter into the chat, but my understanding is that they have survived challenges. There's almost always challenges, but it's whether you prevail, and I think they have.
Great, thank you. Next one. Has anybody found a way to monitor and correlate a possible shift to the black market when these policies come into play?
So this is, often a challenge, I think, in studying. In our sales data, we're not able to do that. I know that in a bunch of the simulation studies, including the Oakland one that I referred to earlier, others that I know Kurt has been a part of, we have built in sort of an assumption about the degree of evasion that might occur. And so that's one way that that sort of has been factored into some of the simulation evidence, but it's not something that I can speak to directly in my data. And it's really, I think, not possible with using the retail sales data that we're using. You'd need other approaches. Yeah.
Thanks. That makes sense. Do you know if increases in tobacco product pricing has had any effect on the price of NRTs?
Yeah, so I'm going to show that evidence actually later, so
Right.
maybe I can table that.
Okay. let's table that one.
Yeah, but generally there's not. I think we don't find an effect of that, but we did want to look at it.
Great. And last question for now. Is there a possibility to offset the resulting increase in the revenues of tobacco companies by imposing a special income tax on revenues derived from the business of tobacco, or non-allowance of certain expenditures involved in the tobacco business as an income tax deduction?
So in principle, I believe that is possible. I don't think that's possible for local jurisdictions to do in California. Getting back to the issue with that they're not allowed to. But yes, I believe those sorts of taxes I think could be done. I'm not sure if an income tax. This is an income tax as opposed to an excise tax, I think is still might not be allowed if it's specific to an industry, but I'm not 100% sure about that.
Okay.
Just one.
Oh, go ahead, Kurt.
Can I just mention one quick thing? Sorry to interject. So one thing, you have licensing fees in most jurisdictions for tobacco product retailers. And so in some places there's almost no fee, or it's a nominal $50 fee. But this to me is a great opportunity to increase the cost for tobacco retailers. And there's good evidence from other countries when they increase the fees up much higher than they could be in the thousands. That discourages the number of retailers from carrying the product line, and so you can cut the density of tobacco retailers through this approach, through increasing licensing fees. So I think that's a good viable option. Thanks.
Fantastic. Thank you. Over to you, Justin.
Okay, great. So I'm going to move on to my results. So here are overlapping histograms looking at the median cigarette price per pack from the year before the MFPL went into effect and the year after. And so you can see that there's this distinct sort of rightward shift in the distribution. Prior to the MFPL, there is a decent percentage of products that were being sold below for a price below the MFPL. After, you can see that there are very few that are being sold below the $8. And so from this, we derive sort of a percentage of products that were complying, which we estimate to be about 98% of UPCs were priced above that $8 minimum. So there was fairly good compliance on the retailer side. Why is this not 100%? It's something that we were not able to address. We would expect, though, that there should be full 100% of the products sort of to the right of that $8 line. And so it is actually, though, about 20% of all cigarette sales were for under $8 products when the MFPL went at the time that the MFPL went into effect. Okay, so then if we move to jumping to our SDID estimates, and this is sticking with the median cigarette price per pack, which is sort of our first outcome of interest. And I'm going to start with the under $8 segment. So again, this is the low price cigarettes that were priced below the MFPL, below the floor price prior to the ordinance going into effect. So we can see from the outcome trends on the left that there was an increase of about 69 cents in price of cigarettes after enforcement of the policy occurred in August 2020. And that's relative to sort of this secular increase that was occurring in the synthetic control group. So there was this sort of increase in price that was occurring over time in the control areas, but there was still this sort of jump that occurred once the MFPL started to be enforced. And then on the right, what we see is sort of how that effect changed over time. With this is the event study plot. And it's showing that there were similar trends before the policy, indicating that the parallel trends assumption might be satisfied here. And there's a small jump during that sort of pre-enforcement transition period. That's sort of the little bump that happens between the two vertical dotted lines. And then there's a 9% increase in cigarette prices over once the enforcement period started. Although that price effect does erode somewhat during that post-policy period. So it's going from about 11% right after enforcement and then starts to sort of like decrease slowly down to maybe 6 or 7% after the 20-month period. So that's median cigarette price. And then if we look at the mean cigarette packs sold, again, among the under $8 price segment, what we see is that there was about a 25% decrease in cigarette sales after the policy started to become enforced. Although here too, we see if you look at the event study on the right, that this effect also appeared to fade a little bit over time. And that's consistent with the price trend. So, if the price trend is what's, if it is really the MFPL that's driving this due to sort of increasing prices, then it makes sense that we would see sort of this fading of the effect as the price effect starts to wane a little bit as well. Okay, so then, so far we've looked only at the under $8 segment of cigarette prices. So now let's sort of let's expand to look at cigarette prices or cigarettes overall, not just the under $8 segment, and we can look at the over $8 segment too. So we're going to observe overall for cigarettes an overall increase in cigarette price of about 1%. During the post-enforcement period, that's in the rightmost column within the red rectangle. But then it's a 9% increase for the below MFPL segment. That's what I showed you a moment ago. And there's actually a 2.4% increase for the above MFPL segment. So that's sort of interesting that that these are products that should not have been directly impacted by the MFPL, yet we're still seeing this smaller uptick in prices. And if we look at overall cigarette sales, we see that those declined about 15.5%. Although this is quite imprecisely estimated, just due to sort of the SDID procedure we're using. The below MFPL segment, this is what I showed you a moment ago, they had cigarette sales decreased of about 25%, but we're not seeing any substitution to the above MFPL segment. So you'll notice that these coefficients are negative as well, which means that there's actually a decrease in sales for this above $8 segment as well. And so there's not really much substitution that's happening, or at least that we're able to detect between the sort of MFPL affected products to the unaffected higher priced products, which is also an interesting pattern here. Okay, so now I'm going to turn to cross-border shopping. So what happens within the ZIP3 that's located just around the 945 ZIP3? And you'll see that we don't find much of any change in cross-border shopping for low-priced cigarettes in the border area. So on the left, you'll see that there's sort of this very parallel change in outcome trends between the Oakland adjacent area and its synthetic control. And then when you look at the event study, there's just sort of no difference, no effect or change over time between the Oakland adjacent area and its synthetic control. So neither are showing evidence of increased cross-border shopping that's happening, which to us was a little bit surprising. Okay, so far I've only showed you cigarettes. The story is actually somewhat different when we look at cigars, quite a bit different, in fact. So here we're showing again the histograms for cigarette prices per pack in Oakland during the year before, in the year after the MFPL went into effect. And what we see is that retailer compliance is abysmal. It's only 7.4% of cigars were priced above the floor price after the policy went into effect. There's really not much evidence of a rightward shift. In other words, most cigars basically continued to be sold for less than was stipulated under the MFPL ordinance after it went into effect and after it was supposedly being enforced. So we did ask county public health officials where Oakland is located, what's going on here? Why is there so much non-compliance? And what they thought was happening is that was due to a few different factors. So one is that there were a lot of competing demands during the pandemic, and that there wasn't much attention placed on enforcement. There was pretty limited capacity for enforcement of tobacco policies in general during this time, and supposedly there was more prioritization of enforcement of the expanded flavored tobacco sales restriction that I talked about earlier. So basically, cigars was getting a pass effectively. We also heard that retailers had complained to the city basically about being unable to stock little cigars and cigarillos that were compliant with the minimum package size requirement. You might recall that there was this minimum package size requirement that was also part of this ordinance, where you had to have at least 20 little cigars or cigarillos, and that for a lot of UPCs that wasn't possible, and so that enforcement might have been lax for that reason as well. So in other words, very poor compliance with the among cigar UPCs in Oakland. And so the SDID estimates basically confirm what we just saw sort of descriptively, that there was no increase in the price of cigars during the post-enforcement period. Despite, however, and we'll come back to this later, despite the lack of any price increase, cigar sales actually were cut in half during the post-MFPL period, decreasing by about 50% overall and 59% for the below MFPL segment. So, and again, I'll try to explain what we think is going on there a little bit later in the talk. For cigars, we do find a smaller degree or some degree of cross-border shopping, with about an 11% increase in cross-border shopping for cigar products, sort of partly offsetting the decreased sales that we see in Oakland proper. Okay, so there is some cross-border shopping for cigars that's happening in the Oakland adjacent area. Okay, so when we look at what's going on with product substitution, we can see that we don't detect substitution to ENDS or NRT products in Oakland. Although the confidence intervals here are so imprecise that they're basically not informative. So we're not really able to say much. And apologies, I thought that I do have, this is just looking at sales of these substitute products. We do in the paper also look at changes in prices of these products, and we don't find much changes in prices either, going to the question in the chat that somebody had. So there's also not any change in cross-border shopping for ENDS or NRT products in that Oakland adjacent area. Okay, so not much cross-border shopping for product substitutes happening. Okay, so we also did some back-of-the-envelope calculations of the aggregate change in sales of cigarettes and cigars following MFPL implementation. So this was basically applying our SDID effect estimates, or those effect sizes, combining that with sort of the number of products that were being sold by product category during the month prior to the MFPL. So sort of like how big the change was in the post period. And then also factoring in any offsets that happened due to cross-border shopping. And overall, what we found was that we're estimating that the Oakland's MFPL led to an aggregate sales decline of lower priced cigarettes and cigars, about 33% in Oakland, and an aggregate sales decline of all cigarettes and cigars of 16% to 18% after the MFPL went into effect, depending on sort of like we did this a couple of ways. One, we did it sort of just by product category. The other, we did it by product category and price segment. So these are sort of, you know, fairly sizable changes if we take them at face value. But I do want to come back to the co-occurring tobacco policies that went into effect, because these do represent limitations and important limitations of our analyses. And so let's talk through a little bit sort of like what expected impact these other policies might have had, because some of them I think might be more important than others. Okay, so first, again, Oakland expanded its sales restriction of flavored tobacco products to cover adult-only stores. Most notably, this included tobacco specialty shops, smoke shops, and vaping shops. And so while this should, in general, reduce sales of cigarettes and cigars, the flavor ban was already covered flavored cigarettes and flavored cigars in our data, because our data did not include those adult-only stores. So if anything, this policy would have actually pushed substitution away from these adult-only stores back to things like convenience stores and other types of stores that are in our data. So a little bit counterintuitively, this flavor ban would have actually, it would have actually acted to increase sales of cigars and cigarettes in Oakland stores. And to the extent that that would have happened, it would have actually led us to understate the effect of the MFPL. So that's one thing. That the expanded flavor ban might also have dampened product substitution to ends. And so I noted earlier that we don't detect much ends product substitution, but one reason why that might be the case is because of the flavor bans that were existing in Oakland, both because of the existing flavor ban in pharmacies and other stores in our data set, as well as this expansion that happened in the adult-only stores. Finally, this expanded flavor ban might have exacerbated cross-border shopping, because now people are not purchasing, say, their flavored cigars in Oakland. They might purchase them in border areas, and so that should increase cross-border shopping. So it's kind of notable that we are not observing a huge amount of cross-border shopping, even incorporating this expanded flavor tobacco sales restriction. Okay, so that's this first policy that occurred at the same time. There's also a second policy, which is the pharmacy sales ban, which banned tobacco sales at retail pharmacies in Oakland. So pharmacy sales were not a large share of cigarette and cigar sales prior to the MFPL going into effect. And so for that reason, we think that the impact of this pharmacy sales ban would be somewhat limited. Although it could have exacerbated cross-border shopping. So that's the pharmacy sales ban, probably less important. The MFPL, as I mentioned earlier, also included a minimum pack size requirement for little cigars and cigarillos. And we did observe convenience stores reducing the number of cigar products that they offered after this ordinance went into effect. And so we do actually think that this reduction in the offerings, the product offerings for cigars, might have been a big factor in why we observed such a large decrease in cigar sales. So that would be about that decline in sales would be less about the MFPL and more about this minimum pack size requirement. So we do think that this is actually possibly the most important of these three co-occurring policies that went into effect in Oakland. Okay, so just summing up our findings, what we find is that there were large decreases in sales of cigarettes and cigars, especially those that were priced below the floor price. based on those back of the envelope calculations, there were these aggregate sales declines of maybe in the neighborhood of 15% to 18%, depending on our approach. Though again, that is also somewhat imprecisely estimated. We found really poor compliance with the cigar portion of the MFPL in particular. And that suggests that this sales decline that we observed was unlikely to be attributable wholly, at least due to the MFPL. And I already talked about sort of the lax enforcement that occurred. We didn't find much evidence of cross-border shopping, especially for cigarettes, even though there were these sort of co-occurring policies that might have actually pushed consumers toward shopping elsewhere. And we also did not find much substitution to ENDS or NRT products, although especially the ENDS portion is quite limited based on sort of the context of Oakland having this flavored sales restriction. So overall, I think we believe that tobacco MFPLs do merit more attention as a pricing regulation, and I think there is probably an opportunity for more research for their impacts. So thanks so much. I'll now turn it back over to Kurt and Jamie.
Thank you so much, Justin. Over to you, Kurt, and please do keep those questions coming as well to our audience members. If we don't get to all of them, they will be sent to Justin afterwards.
Great, thank you so much. That was just excellent. So first, this is probably the best evidence we have of the potential impact of a well-implemented minimum price law, floor price law. And you had a really strong design with this difference approach, the synthetic controls. You had high compliance, at least on the cigarette side. So this, I think, really is the best test of their merit. And I think they passed the test. And even if you have some cross-border evasion, which is not ideal, still in our simulation studies and your real world one, it shows that there still can be an effect. So almost every policy has some types of unintended consequences, and you have to make a go, no-go decision. But even with some limitations, it seems like a solid policy. Secondly, the enforcement, the compliance was challenging on the cigars, and that was a little bit surprising. We know that little cigars and cigarillos often have a higher use rate among Black individuals and sometimes Latino populations. And from a disparity standpoint, we've really got to make sure that that is addressed in sort of the next phase, and we really need to better understand that. You could say it's really complicated to enforce these, but what's interesting, this is I think, of the two types of floor price laws out there, one is just a set price. It's $8 or higher. Other places have different numbers, but that's easy to enforce. The one that's hard to enforce are like the minimum markup laws that say it has to be 8% above the wholesale price. If you have 100 stock keeping units, you may have 100 minimum prices. And so in New York, they have these books, sometimes of like 40, 50 pages of price sheets. And so it's almost impossible. But when you have a single price, it makes it much more enforceable. And that's the next, I think, frontier. And the final point I would say is that waning impact that you saw in several cases. That it's my understanding from the economists is that you get the biggest price shock in the beginning. So if you have an increase, you see the price shock, and then the kind of effect weighs off over time. It sort of wanes. So that's kind of typical. And for instance, when New York City implemented their minimum price law, they started with a $10 floor price on cigarettes. Then they went to 13. So it may make sense. You talked about periodically refreshing it. As an economist, is it better to say, let's wait 3 years and increase it by a buck or two? Or do you do the inflation adjustment, which is kind of ties into a question when someone said, what would you advise the people to do? Because I would be trying to figure out the enforcement of the cigars, but would you do cost of living, or would you try and do a bump a few years later? What's best?
Yeah, it's a good question. I think that the larger increase is going to be more salient for consumers. And so, all things equal, I think that would have a bigger impact. However, if that's not built into the ordinance, that would require additional action from the local government. And, oftentimes that might not happen. And so for that reason, I think if you're relying on sort of continued regulatory action that it's possible that those sorts of regular bumps might not occur. So I think building in the inflation adjustment for, adjusting for the fact that the floor is going to basically be eaten up by inflation over time, I think is probably something that I recommend, just because it's sort of like an automatic increase.
Thanks so much. And thank you so much to our discussant. I'm going to move over to some audience questions now in our last 5 minutes. So first one, would it be worthwhile to look at the effects on sales of other spillover products? For example, decreases in beer purchases may have spillover public health benefits, decreases in baby formula purchases may have spillover public health costs.
Yeah, definitely. It's not something that we looked at here. I think one could imagine that there are spillovers. If people are shopping elsewhere for their tobacco products, they could be shopping for other products elsewhere as well. And so I think that would be important to look at. Alternatively, if people are spending less money on tobacco, then they could be spending more money on other goods. So in general, I think that's great. It's not something that we looked at here.
Great. And just to clarify for us, Justin, with those co-occurring policies, did they occur at the exact same time or slightly later?
I believe they went into effect at the exact same
At the
time.
exact same time. Thanks so much. Next question. I'm going to rapid fire for you here.
Sure.
Would the prohibition on coupons and discounting accomplish the same outcome as a minimum price on cigarette packs?
Hard to say. I think that one of the lessons from the state minimum markup laws that both Kurt and I talked about earlier is that banning these price discounts can be important. I think that if nothing else, that it would sort of lead to a smaller change, but I don't know if it would sort of accomplish the exact same thing if you just had sort of a price, a ban on coupons, but not also having a floor.
I'm a fan on all of the above of what Mike mentioned, but you still are going to have this, the high price brands all the way down to the lower, and you're trying to just affect that lower bit. And then even if you don't do the coupons, which coupons can be on Marlboro, the more premium brands. So it is a little something different, but if I could have any policy, it would be banning all price discounting. That's the one that there's so many products on buy down. It's a big strategy by the industry, and that's how they keep retailers always advertising product, because as a requirement of getting that discount, you have to put a lot of ads up and prime placement.
That leads me nicely onto another audience question. So, Justin, if you could ask the Oakland mayor and town council about the next steps here, what are 2 new ideas you might recommend?
Gosh, I don't know exactly what I would recommend. I mean, I think that doing the adjustment for inflation and sort of continue, would be something that would be worth doing to accomplish sort of the continued reduction in sales, assuming that sort of being eaten up by inflation. And I'd have to think about, I think, what another idea that I'd ask the mayor would be.
Okay. And did you see that little cigar brands and sub brands fell, or only the UPC offerings? The asker wonders if part of the decline is the consolidation of smaller unit packages to the larger 20-unit packs.
Yeah, great question. So we definitely saw a big decrease in the number of UPCs. We also did see, so I didn't show it here, but I think we also looked at dollar sales, and there was a decrease in dollar sales as well. And so I think it's not just about the sort of number of UPCs and its consolidation.
Great, thanks. And did the number of vape shops in Oakland go down as a result of the flavor ban? Do you happen
Yeah,
to?
I wish I remembered. I don't remember. This is during COVID as well, so it might not be just about the flavor ban that was happening. I'd have to go back and refresh my memory. It's a good question though, Mike.
Okay, great. Thank you so much. I'm going to hand over to our MC to close us out.
We are out of time. Thank you for our presenters, our moderator, and our discussants. And thank you all for our 135 audience for your participation, and have a wonderful and top-notch weekend.